Welcome to Roadmap to Residency. Hello everyone, I am Abhi. Welcome to our Club 250 Matchmaker sessions. We will be running through some questions with you guys to help you on a journey toward 250. So here we are, which of the following is the most likely diagnosis? A 45-year-old woman comes to the office for evaluation of anxiety. The patient works as a mechanical engineer and recently declined a promotion to be a project manager. Although her salary would have increased significantly, she felt that overseeing other employees and leading team meetings would be too stressful. She says, if something were to go wrong, everyone would blame me. I don't even know with why they offered me this position. The patient enjoys her job but tends to eat lunch by herself because she feels that her co-workers do not like her appearance or sense of humor. She has never had a long-term romantic partner but fantasizes about getting married someday. The patient lives alone, rarely socializes with friends, and is close with her mother, whom she describes as the person I can always rely on no matter what. Which of the following is the most likely diagnosis? Acute stress disorder, adjustment disorder with anxiety, antisocial personality disorder, avoidant disorder, generalized anxiety disorder, or paranoid personality disorder. So these are the cluster A, B, and C sort of personality disorder types. So in cluster A, we have paranoid, schizoid, and schizotypical disorder. Okay, so in paranoid, we have suspicious, distrustful, and hypervigilant sort of behavior. Schizoid prefers to be a loner, detached, and unemotional. Schizotypal have unusual thoughts, perceptions, and behavior. Cluster B is dramatic or erratic type. Number one is the antisocial, which the patient may show symptoms of disregard and violation of the rights of others. Borderline have chaotic relationships, abandonment features, labile mood and impulsivity, and inner impotence and self-harm. Histrionic, superficial, theatrical, attention-seeking, narcissistic, grandiosity, and lack of empathy. Cluster C, anxious, fearful, avoidant, avoidance due to fears of criticism and rejection, dependent, submissive, clingy, needs to be taken care of, obsessive-compulsive, rigid, controlling, and perfectionistic type. So this patient's pattern of avoiding social interactions and hypersensitivity to criticism is characteristic of avoidant personality disorder. Patients with this disorder typically have a very limited social relationships due to fear of being judged, embarrassed, or rejected. They desire social acceptance and may fantasize about having relationships, as in this patient. However, they struggle with feelings of inadequacy and pursue relationships only if certain of absolute acceptance by others. Occupational dysfunction due to difficulties interacting with co-workers or turning down promotions due to fear of criticism is common. Acute stress disorder involves exposure to a life-threatening event with resulting flashbacks, intrusive memories, avoidance, negative mood, hyperarousal, and dissociation from reality. In adjustment disorder with anxiety, a disproportionate level of worry develops within 3 months of onset of an identifiable stressor. Now, this patient's chronic anxiety symptoms appear to be related to a long-standing fear of rejection in social situations and low self-esteem. Antisocial personality disorder is marked by persistent disregard for and violation of the rights of others. Generalized anxiety disorder, we have already discussed in previous videos. Paranoid, also discussed in previous videos. So individuals with schizoid personality disorders are all socially avoidant, but they tend to be content with their social isolation. Patients with this disorder are emotionally detached and have a limited range of effect, do not desire social acceptance, and prefer to be alone. So these are the personality disorder subtypes and types from your first aid. So inflexible, maladaptive, and rigidly pervasive patterns of behavior causing subjective distress and or impair functioning. Person is usually not aware of problem, egocystonic, usually present by early adulthood. Contrast with personality traits, non-pathologic in enduring patterns of perception and behavior. Three clusters, cluster A, B, C. A, odd or eccentric, no psychosis, genetic association with schizophrenia. Cluster B, dramatic, emotional, or erratic. Cluster C, anxious or fearful. Cluster A, paranoid, schizoid, and schizotypal. So A, paranoid are pervasive distrust, suspiciousness, hypervigilance, and profoundly cynical by view of the world. Schizoid prefers social withdrawal and social activities. Okay, a limited emotional expression, indifferent to others and opinions. Schizotypal, eccentric appearance, or beliefs and magical thinking. So cluster B, we have antisocial, borderline, histrionic, and narcissistic sort of disorders. So antisocial is disregard for the rights of others with lack of remorse, bad. Okay, involves criminality, impulsivity, hostility, and manipulation. Sociopath sort of people are antisocial. Uh, Males are affected more than females and must be more than 18 years old with evidence of conduct disorder onset before age 15. So if patient is less than age 18, diagnosis is conduct disorder. The same symptoms, but age less than 18, diagnosis is conduct disorder. Borderline, unstable mood and interpersonal relationship, fear of abandonment, impulsivity, self-mutilation, suicidality, sense of emotional emptiness. Females are more than males. Splitting is a major defense mechanism. Treatment is dialectical behavior therapy. Histrionic, attention seeking, dramatic speech and emotional expression, shallow and labile emotion, sexually provocative. Narcissistic is when the patient have grandiosity sort of behavior, sense of entitlement, lacks sympathy, and requires excessive admiration. Often demands the best and reacts to criticism with rage and or defensiveness. So they cannot handle criticism. Hypersensitive to rejection and criticism, socially inhibited, timid, feelings of inadequacy, desires relationship with others, obsessive compulsive for preoccupation with order, perfectionism and control, egocystonic behavior consistent with one's own belief and attitudes. Dependent even this excessive need for support, submissive and low self-confidence. One more question here. So which of the following best characterizes the primary features of borderline personality disorder in this patient? Grandiosity and a need for admiration, fear of social situations and avoidance of interpersonal contact, preoccupation with perfection and orderliness, intense and unstable relationships, impulsivity, recurrent self-harm, intrusive thoughts and repetitive behaviors. A 25-year-old woman presents to the mental health clinic reporting a history of unstable relationships, impulsivity, and recurrent self-harming behaviors, including wrist cutting. She describes a broad pattern of intense and stormy relationships, alternating between idealization and devaluation of others. The patient fears abandonment and often engages in frantic efforts to avoid real or perceived abandonment, such as making suicidal gestures when she believes the relationship is ending. Despite frequent mood swings, the patient reports a chronic feeling of emptiness, and she has a history of multiple brief and tumultuous romantic relationships and difficulty maintaining stable employment. Which of the following best characterizes the primary feature of borderline personality disorder in this patient? So, intense and unstable relationships, impulsivity, and recurrent self-harm. These features are primarily for the borderline personality disorder, include a pattern of unstable and intense relationship, impulsivity in areas that are potentially self-damaging, and pervasive fear of abandonment. So which of the following are the primary features for the antisocial personality disorder in this patient? 30-year-old man with a history of frequent legal troubles, deceitful behavior, and lack of remorse for harming others, present to the psychiatric clinic. He describes the pattern for irresponsibility, impulsivity, and repeated violations of the rights of others since adolescence. The patient admits to a history of aggressive behavior, physical fights, and a disregard for the safety of himself and others. He has a charming demeanor but exploits others for personal gain and lacks genuine empathy. Despite facing legal consequences, he shows no intention of changing his behavior. So, which of the following are the features for antisocial personality disorder? Fear of abandonment and unstable relationship, perfectionism and preoccupation with the details, chronic feeling of emptiness, frequent legal troubles, deceitful behavior and lack of remorse, excessive need for admiration and sense of entitlement. So, the correct answer is D. Frequent legal troubles, deceitful behavior, and lack of remorse. The primary features of antisocial personality disorder include a pervasive pattern of disregard, uh, uh, repeated criminal activities, deceitfulness, and lack of remorse for harming others. Which of the following the features of the narcissistic personality disorder? So, 25-year-old man seeks psychological evaluation due to interpersonal difficulties and strained relationships. He describes a pervasive pattern of grandiosity and excessive need for admiration and lack of empathy for others. The patient often exaggerates his achievements and expects special treatment from others. Despite a lack of genuine achievements, he insists on associating with high status individuals and belittles those who he perceives as inferior. When criticized, the patient becomes engaged and or shows disdain, and he's unwilling to recognize the feelings and needs of others. So, which of the following best describes the narcissistic disorder in this patient? Grandiosity, need for admiration, lack of empathy, as like we have discussed in previous slides. Thank you for watching. Keep studying hard.